Courage Speaks. Courage Speaks. Courage Speaks.
Welcome to episode 9 of Courage Speaks. I'm your host, Sam Sherman. Courage Speaks is brought to you by Courage to Connect, an outpatient mental health center for therapy, psychological testing, and psychiatry for all ages located in Chicago's North Shore. Today, we're diving deep with Keri Golding, a licensed clinical social worker and clinical supervisor here at Courage to Connect Mental Health Center. Keri brings a wealth of experience and compassion to her practice, specializing in a range of areas including ADHD, anxiety, parenting, and women's issues. But what truly sets Keri apart is her deep-rooted commitment to creating a safe and nurturing space for her clients, a space where exploration and growth can flourish. Throughout our conversation, Keri shares her journey into the world of mental health, revealing how growing up in an enmeshed family and her background in social work laid the foundation for her patient-centered approach. We delve into her passion for working with mothers navigating the complexities of parenthood and the unique challenges they face. We also explore the influence of social media on adolescents and how Keri helps her patients navigate these potentially turbulent waters. And of course, we couldn't let Keri go without uncovering her secrets to practicing self-care. So, whether you're a parent seeking support, an adolescent navigating the complexities of growing up, or simply someone looking to prioritize your mental well-being, this episode is packed with wisdom and guidance from someone I'm extremely lucky to be able to call a colleague. Stay tuned for our enlightening conversation with Keri Golding, coming up next on Courage Speaks. Keri Golding, thank you for joining Courage Speaks. How are you today?
I am doing well, and you?
I am also doing well. Yeah. I'd like if the weather today were the weather that we had yesterday, but it is the Chicagoland area, so we know that that's not something that we get.
That is true.
Well, I've been really looking forward to speaking with you. It was really fun. This is like kind of inside baseball a couple of weeks ago, and we had a chance to kind of talk about, you kind of said, what can we talk about? You know,
Right.
And I think that it's always interesting because for me, just anybody that I've spoken to for this podcast has just been such an education for myself. And so there's not like a specific agenda or anything like that.
Yep.
I just want to learn about you.
Okay.
So as with that in mind, tell me a little bit about your story, kind of what got you into this field of mental health counseling.
So I was born to a parent with a sister who was a year and a half older than I was, who was born deaf. And so we had a pretty enmeshed family because everything that was said needed to be repeated over and over again. Everybody needed to know everything. My father was a physician. My mother was very heavily into what we would now call special education, but at that time it was Committee on the Handicap. And so I kind of grew up in a family of people who gave back and worked a lot with the disabled community. So I never knew that I was going into mental health, but this is kind of what my family enjoyed, was giving back and volunteering. And so when I got into school, I knew I wasn't a scientist.
Same.
Math was not my strong suit. And what I really liked was people, engaging with people. And I just found that I was drawn to all the sociology and psychology classes. And so that was kind of the way I went. And I got out of college and I said to my dad, I want to go to graduate school. And he said, great, go work in the field, make some money, get some experience, make sure it's what you want. So without a master's, and this was like 30 years ago, it was hard to find a job. So I ended up working with developmentally disabled senior citizens who had pretty much all been institutionalized. And then at that point, they had stopped institutionalization. And so you were basically teaching 60 and 70-year-old people how to count change, how to ask to go to the bathroom, just independent living skills. So after that job, I was like, am I sure I really want to do this? But when I went to graduate school in social work, what I realized is there's so much you can do. I mean, anywhere from, research to working with so many different populations. So along the way, I kind of realized I really liked working with kids and I loved the education system. And so I started out in school social work. And what I loved about school social work is I learned so much because you're part of a team. And so you're learning about the educational piece and the psychological piece and family work. And I loved school social work because of that. What I hated about it was the politics.
Mm.
And listen, there's politics everywhere. I mean, there is, unless you own your own thing. But it was a great learning experience. And so that was kind of my basis for getting involved in social work.
Mm-hmm. What do you think about your dad's advice at that time as you reflect back on it? So before going into graduate school to kind of get some work out in the field.
I think it was great advice.
Mm-hmm.
I think that it's a test of, is this really what you want? Before you put down the money and the time, is this really what you want? I don't think back then I really realized that there were so many differences between social work and psychology and PsyD. And I mean, there's so many different majors and different ways to get into the helping profession now. I wouldn't take back my education. I thought it was amazing and I learned a lot, but that was over 30 years ago and so much has changed now. I think that real world experience, there's just nothing that tops that.
Mm-hmm. And you really came out of the gate with a very, unique population too.
Mm-hmm.
And so you said that when you first started working with that population, or even during working with that population, you maybe had some apprehension of, is this something really that I want to do? So what was that kind of shift or what was there like a moment where it kind of locked in? And was it at that point where you said, yeah, this is what I want to do? Or was that not until you got to the school settings and working with children?
So when I was working with developmental disabled senior citizens, I knew that wasn't the area I wanted
Like
to
the
be
specific
in. Specific.
Mm-hmm.
So I had some friends that were a year older than me in graduate school, and I would go. I made 3 different visits, 1 to a therapeutic school and 2 to regular schools where I was able to shadow them for the day. And that really excited me.
Mm-hmm.
And that's when I said, I want to go into social work and this is the direction I want to go in.
Mm-hmm. What's something that you feel like over the years that you've seen, because, when we talk about the mental health field, there's been in some ways a lot of changes and in some ways not so many changes, right? So I'm curious from your perspective, from when you first entered the field, and even if it's specific to the field of social work, to maybe what some observations from when you first entered to kind of what you see now as far as some of the biggest things that have changed just in your observation.
Well, the greatest change has been technology.
Mm-hmm.
So, back in the day, almost everything was done by paper except reports. And so the fact that all communication, within your agency and to your clients and to, everything is done via computer.
Mm-hmm.
So that is a hard thing to change in your mind. So that was the first big change. The second thing is there's so many kinds of therapies now.
Right.
I mean, when I went to school, there were about 5 or 6 basic types of therapy that you focused on. Now there's over 50.
Mm-hmm.
I mean, and sometimes somebody will come in. I mean, there was a text message today about a certain type of therapy. I'd never even heard of it, you know?
Yeah.
And it's probably very similar to another type of therapy.
Right.
But so keeping up with modern times and going to continuing education, it is so important because the field has changed so much.
Mm-hmm. So as we kind of fast forward to 2024 here at Courage to Connect, what was your pathway to winding up at Courage?
So I took off a significant period of time from working to raise my kids. When I went back, I started in school social work, and then not long after COVID hit. So I was doing school social work virtually and felt like I was not making a difference. I
have to ask, school social work in person I have to imagine, is challenging. Virtually, what was that like?
I mean, I felt ineffective. I would have a group with 4 kids and 2 would show up and 2 wouldn't. And you spend 20 minutes trying to get in touch with the parents, trying to get them connected. There was so much. I mean, listen, nobody was prepared for it. And
Right.
so we didn't have a better system in play, and we tried to make do with what we had, but it was very ineffective. And so at the time, I had a friend that was in private practice at Courage to Connect, and she had been having a very positive experience. She too had been a school social worker. So I decided to take on a couple of clients, and that's how I started. I started with 2 clients. I wasn't confident when I first started just because it was new, and anything that's new is challenging. And then I really started enjoying it. I mean, other than the fact that you have to work after school hours,
Yeah.
which can be a little draining, I really enjoyed it. And since then, I've been, adding more and more time to it.
Mm-hmm. So, like you said, whenever there's like change or anything new, there's going to be that adjustment. How long do you think it took for you before it felt like something that in this kind of space or this kind of environment, it kind of clicked, or has there been that? Like, yeah.
I would say that I had this feeling driving to work of nervousness for the first 6 months. And still, every time I get a client, I'm a little nervous. Again, it's new and I don't know what to expect. But now I would say there's a mixture of nervousness and excitement, whereas before it was just nervousness. I think first you have to feel confident in your abilities, and really experience is the only thing to give you that. But yeah, I would say after about 6 months, I felt a little more grounded. And after a year, I definitely felt more confident.
Is there a specific population that you generally have been working with while at Courage? Has that been mostly children?
It started with children and adolescents. And I think some of my interests have evolved as I've been here. So I've become much more interested in gender and sexual identity issues. And I'm finding that that's really more with teens and young adults. And I've found that I like working with women in transitional states. Whether it be first having children moving out of the house, and probably because a lot of it's relatable. But I've gotten more interested in that. So I typically now see kids over 12.
Okay.
I think that's where my skills are utilized best, and women.
Can you talk a little bit more about that interest, specifically like women in different transitioning times in their life, and kind of your interest around working with that population?
I guess the reason that it's of interest to me is because that's where I've gotten stuck in my own life. It's kind of a combination of transitions and parenting, because there are different states as a mother, which is probably why I like working with women better, where you're the center of your child's world, to then kind of adolescence where you're on the outside of your child's world, and then young adulthood where you kind of find a little bit of that, immersion of
Right.
both. And for me as a mom with my first child, I had major enmeshment issues. He had issues. I was the fix-it mom. And I learned a lot from that of what I did wrong. I also learned, through my own therapy, like what drove me to be like that, why. And I'm finding so many moms in this type of generation who can't see their kids in pain and want to fix it. I know I'm going off on a different tangent.
No,
but,
please. Yeah.
okay. And I so love working with these moms to discover the pieces of themselves and why they choose to be the fixer, and how they feel it kind of gives them identity. And when there's a loss of that, a mom sometimes feels like they don't know what their role is. How can they just step back? They need to know everything that's going on. And so to me, those were places where I got stuck. And so I just, from my own knowledge, I love working with moms who get stuck in those places and identifying what's going on with them that they're getting stuck. It's not their children, and their children are going through normal phases,
Right.
and they're difficult phases. So that's really what got me on the piece with women in transition. I also like working with women and men on parenting stuff
Mm-hmm.
because there is no book on parenting. It's amazing. You want to go into any kind of profession, you have to learn. But to be a parent, there's nothing other than what you came from.
Mm-hmm.
And sometimes that's destructive. And so I think parenting is probably more of where I want to go in the future
Mm-hmm.
because I think every parent needs a little help.
Mm-hmm.
I mean, none of us know. None of us have been parents before.
Mm-hmm. It's funny. I'm not a parent yet, but I was talking to somebody the other day, and I don't know when this was. It was at some point growing up. I remember looking at my parents, and maybe I was in elementary school or junior high, and I looked at them, and I had always had this obviously not a rational thought about this, but I would kind of look at my parents, or maybe any adult when I was a child, and think, so there must be a point between when you're a child and when you're an adult. And there's something, I don't know if you go into like a chamber, you get frozen to wake up. And then it occurred to me, something blew me away about the fact that the reality that my parents are the same people that they were when they were children. It's just they went to sleep and woke up and went to sleep and woke up enough times to now they're adults. And it was something about that was eye-opening to me when I had that kind of obvious realization. But it was something where it's oh wow, they just sort of kept sleeping and waking up until one day they're parents, and you have to sort of figure that out. And it's been so interesting to kind of think about things through that lens.
Right.
But you're so right. Of course, there's not that as many people have tried to write books about that.
Right.
There isn't the one book that'll cover everything or anything like that. So to be a support, to be a place for parents to go to, and I think also just to normalize that.
Yeah, absolutely.
Mm-hmm.
Absolutely. It's funny you said that because when I was a kid, my dad used to sleep with no pillows and my mom used to sleep with 2 pillows and I slept with 1. And I thought that kids sleep with 1 pillow. And if you grow up and become a daddy, you sleep with none. And if you grow up and be a mom, you sleep with 2.
Yeah. And without exposure to something different, then that's what you'd know.
Absolutely.
And there's much larger ideas about that happen through development and everything like that. But I think that's a really interesting anecdote because that could just be, you could still think that today if there wasn't if you didn't know another way.
Absolutely. And then you start working with kids that are transgender or gay, and you have parents saying, I really don't know how to parent this kid because, I can go to my friends about how they, parented their young son or their daughter, but what do I do with this?
Mm-hmm. Has that been something that you've had more of an opportunity to work with in, I don't know, more recent years, in the last few years?
Oh, yes. Yeah. When I first was in the field, and so that was a long time ago, like 25 years ago, probably as old as you are, there was no talk about it. There was absolutely no talk about it. And then when I came back into the field about 6 or 7 years ago, there was definite talk about it. And I'd be in middle schools, and it was where it was hard is that I had all these girls that were like, oh, I think I'm gay. And it wasn't like in seriousness. It was more of, I'm going to try this out. Mm-hmm. And I do think there is more of that nowadays. It's a little more acceptable that you can try being with a girl, try being with a guy, and see what happens. And so that was new for me. Mm-hmm. And in the last couple of years, it's become so much more acceptable that I think kids are coming out, or at least expressing their feelings, a lot sooner or with a lot more comfort than there was in the past.
Mm-hmm. And I think it's interesting, too, that you've had this opportunity to work with probably, again, both the children that are going through these that are experiencing these things, and also the parents
Yes.
of those children, right?
Yes.
Not necessarily those and those children, right? Both in different settings and everything like that.
Yeah.
And so one of the other things I was curious about is just in your time in this field, one of the things I like to talk about on this podcast is like the stigmas in mental health counseling and seeking help and reaching out, and then also working toward like the destigmatization and what that process has been like. Have you seen that? Like, how have you seen the stigmas change or become destigmatized as far as even working with new patients, working with new people that are coming in maybe to therapy for the first time? Have you seen changes over time like that?
Yeah. I think that things that were not spoken about are spoken about more. I'm actually finding the younger generation is, I mean, I know most of it is through Snapchat and Instagram, but they are pretty well educated on the things that are important to them and are more confident talking about it. However, what I do find is a lot of the kids, they react in relation to their parents. And so if this is something parents are comfortable talking about, kids are significantly more comfortable. You can tell when you talk to a kid if there's shame around this subject or not. So sometimes I think it's the stigma happens more within the family than out in the community. I think the community has gotten better. But, I'm talking about the North Shore as the community I'm talking about. I think there are different communities where it's different.
But ultimately it starts at home.
Yes.
From what your experience.
Absolutely.
Yeah. Is that a conversation, like if you're working with children and you're noticing that it seems like some of these stigmas are based in kind of that starting from home, how is that something that becomes approached, I guess, in your experience?
So I think it very much has to do with the child or the client you're working at and what their comfort level is, and if bringing it to the parents will be helpful or destructive in their relationship. And so, your relationship is with the client, and so it's what would be helpful to you. Would it be helpful if we brought mom and dad in and had this conversation? Would it be helpful if I had this conversation with them? Do you want to have this conversation with them and then use me, as a springboard to talk about it? So it's their comfort level, and I've had a variety of responses. I mean, I've had some kids that say, "No, this stays in this room, and it's not coming out until I'm 18 and I leave the house." Right. And then there are other kids that's like, "It would be really helpful. Can you sit in here and help me share this with mom?" Yeah.
I think that's such a great point, because again, even as I've been working with adolescents and parents and all that, in seeing the fact that trying to sort of balance, I was going to say juggle, but I like balance more, the creating that idea of autonomy for the like child or the adolescent client, but at the same time starting to see how parents can be a part of that. I think maybe I talked about this the other day with you, but this idea that like we meet with clients generally for 1 hour a week. Yeah. They're oftentimes with their parents or guardians or caretakers way more than they're with us, right? Yeah. And so figuring out how to make that kind of all work, but also understanding, like you said, through what's comfortable to the individual, right? Because that's going to completely vary,
right? And it depends on the age too. I mean, I am a strong believer in child therapy. You have to do work with the parents too. I mean, they are a unit, and I would say with 90% of the issues. And then once they reach that kind of 12-year-old range, then it has to do with the child and their maturity level. Right. But I think that so much of the work when they're young is family-based. And if you can't get parents on board to see their child for who they are, and sometimes that's just confused, but then the child's just going to continue struggling.
Right. You said that you re-entered the field right after the pandemic had begun?
No,
right before it. Okay, right before. Okay, perfect. So right before the COVID-19 pandemic, as opposed to the the other one had begun. So I'm so curious, like what you've noticed, especially working with children and adolescents. Well, really anybody, but particularly with that population. Just your thoughts on what you've observed since COVID,
and the reaction from COVID.
Yeah.
I mean, I have seen so many kids struggle academically.
Mm-hmm.
I mean, there are major gaps in learning and kids are feeling it. And especially your kids that are going into like junior year and they have the pressure of college and ACTs and, they sit down for an ACT and realize that they miss this whole segment of algebra.
Mm-hmm.
And I think it causes a lot of stress and anxiety for these kids because they're just missing pieces that they don't know. I think a lot of kids who struggled with like getting to school, or would have social anxiety, they loved COVID. They stayed at home in their, in their comfortable little space
mm-hmm.
and didn't have to go out and kind of deal with whatever it is they're afraid of.
Right.
And because of that, they had so much of a harder time getting back to school. I mean, the amount of kids that went to PHPs and IOPs because they couldn't get their work done. They were afraid to interact with other people. They didn't know how to address teachers. I mean, that gap really affected them socially and academically.
Mm-hmm.
So
you've seen a rise in like those sorts of like the enrollment in those programs and things like that, even just since.
Absolutely. And I see a lot of kids who, when I say, well, when did your anxiety start?
Mm-hmm.
So many of them around COVID. Around COVID, I didn't know what I was missing. I wasn't included in this. I didn't see friends for weeks and I got stuck on my video games. And now my parents can't get me off my video games, but this was what soothed me during this difficult time.
Right.
I think there was so much of a focus on technology during COVID because that's all kids had. That's how they were doing their school.
Mm-hmm.
And you have all these parents complaining they can't get their kids off technology.
Yeah.
I mean, that's a whole nother issue, but I do think COVID was a trigger for that.
Mm-hmm. It was just more time to be on those things, utilizing those things potentially as any kind of regulation or just coping mechanisms and all of that,
yeah.
But to just even higher degree.
To a higher degree.
I've got to ask you a question that at this point is sort of is definitely, social media has been around for now, several years and everything, but just I want to know your thoughts on social media usage for even like as in your experience working with adolescents, working with parents. And again, everybody's different, all that, but from your perspective, is social media more of a net positive or net negative or something entirely different?
It's both.
Mm-hmm.
I remember my kids are in their late teens, 20s. And I remember saying to them, I was so happy I didn't have cell phones when I was in college because, you just kind of leave it out in the open and see what life brings you. And they were like, oh my God, life without cell phones, And now I say to myself, I'm so happy that social media wasn't as prevalent, for their high school, junior high years. I think social media has wonderful perks to it. I mean, I'm originally from New York. It allows me connectedness to all the people that I left behind. I can find answers to things in a split second. So it's got wonderful positives. I think what it does to most of the kids in middle school is it just makes them feel left out or makes them feel like they're not equal to this popular person that
mm-hmm.
has 50,000 friends. But I just think that when you don't have your identity yet and you are insecure, seeing what everyone else has, because nobody posts about their bad days.
No, they don't.
I think it promotes so much pressure on these kids.
Right.
I really do. And I encourage parents when they're getting kids' phones, which is usually happening around 11, 12, 13, that they don't get access to the internet.
Mm-hmm.
I mean, yes, kids should be able to call parents for a ride and maybe text friends for plans. But once you start seeing what the whole world is doing and you're not secure, that's just going to bring you down.
I even found like these social media companies, like they know what they're doing, right?
Mm-hmm.
They're really good at what they do. I had to get off of TikTok probably 4 or 5 months ago because in 2020, 2021, I went on TikTok for the first time and I pretty much stayed on it up until probably early 2023.
Right.
And I noticed, because through the pandemic and everything, it was something that I really enjoyed. I think there's a lot of interesting, content on there. It is entertaining, all that. But I did find at some point, there was one day when I was like, I think this is, for lack of a better way of saying this, sort of melting my brain.
Mm-hmm.
I actually noticed that it was doing something to me.
Mm-hmm.
And I tell people all the time, I think TikTok is an unbelievable source of entertainment. It's great. They're great at what they do of the algorithm and all that. Probably could say the same for Instagram, although Snapchat, whatever else. I also just noticed like, wow, I don't think this is good for me.
Mm-hmm.
And I got off of it. But I think that's kind of the thing is I completely understand the incredible attraction and appeal of those things. So much so because, again, these algorithms, they're fine tuning it for people. And in some cases, fine tuning it to get people angry, to get people engaged in that way. And again, I think, like you said, a lot of the things that whether it's insecurities or comparing yourself to other people, all these things, these are feelings and thoughts and everything that have lasted throughout the history of time. The difference being that social media has created new ways of experiencing these things that did not exist before. There were other ways to whether it was magazines, whatever the case, to compare yourself to other people, to feel insecure, to feel left out. But social media added just more and larger ways of that happening.
Yes, and the fact that people can like other things and not like other things, then you're actually getting a response back,
mm-hmm.
which drives you to want to do more.
Right.
Because everyone loves the attention.
Yeah, and it's just that's the part of it that's new, is that did not, that I can think of, exist in that specific way in the past, of this idea of likes and in this idea of that kind of validation.
Right. And I listen, I believe for social media the same way I believe for food, for alcohol, for exercise. Anything can become an addiction if there's too much of it.
Right.
Everything in moderation should be okay,
mm-hmm.
as long as you have control over it.
Mm-hmm.
But when you're a kid, your frontal lobe isn't fully formed and you go by whatever stimulates you and excites you, you're going to stick with that for hours and hours on end. There's no shut off button.
Yeah. And I think that even introducing potentially early on, going back to this idea of what the parents are talking about or how they're viewing things, is like, if you look at something and were to say to your child from an early age, like, social media is terrible, then, I mean, on one hand, that might be what your child, I mean, although there could be defiance to that too, but the bottom line is it's probably finding that balance and just like education. And if a part of that too is waiting to introduce your child to, or even allowing your child to get onto social media until a certain age, till there's a little bit more development at that point, just trying to find that balance. How can we introduce moderation?
Right. But the problem that the parents find is that you've got social influences.
Yeah.
And so, I mean, you don't want to be the only kid sitting in the car, not on your phone on the way home from dance, and nobody to talk to because everyone's on their phones.
Mm-hmm.
I've found that, like, I find parents that are really good about setting boundaries with all of this stuff. And then the kids are just coming home being like, I am the only one.
Yeah. And
And then the parents feel bad, It's a hard situation. There's a lot of social influence out there.
I think if there's one thing I know, not being a parent quite yet, it's the idea that anything that sounds like, this is something I'm going to try with when I have kids one day, or this, just to basically throw that all out the window and say, you don't really know until
Don't really know until you got them.
Right. And then I'll go to see you, and then we'll even with all the ethical things there, we'll figure it out. So, Keri, thank you so much again for joining. I've got a couple more questions for you. One of the biggest, buzzwords or phrases in mental health in this whole field, especially from, for clinicians and beyond, of course, is self-care, right? And the idea of how to implement self-care. One of the jokes is always that, therapists never really do the things that they'll, talk to clients and patients about, as far as like, those sorts of self-care exercises. So how has that sort of shown up in your life, both when you were first in the field and then re-entering the field in the last several years? What has that word kind of meant, or that idea of self-care sort of meant to you?
So self-care to me used to be exercise, food, and sleep.
Hmm.
So, and I was a really avid exerciser up until COVID. And I completely stopped doing any form of exercise over COVID. I don't know why. I had more time on my hands than anyone else. And so I do try and get a good night's sleep. I try and eat pretty healthy. And I have gotten back into the routine of playing tennis 1 to 2 days a week. It really makes me happy. I feel good. And I've kind of figured out my work schedule around that, because I know if I don't put that in my schedule, I won't do it and I won't do anything for myself.
Hmm.
I do think it is important. I think that everybody needs things to look forward to that's an escape from stress. I wish I could do more of it. I haven't figured out how to balance everything, but at least I feel like I'm doing something for myself. And I try and cook 2 nights a week.
I like that.
Yeah.
Yeah. I'd like to get to 1 night a week. I think it would be good for myself. I was actually recently, I'll share that I texted my therapist to like reschedule or to cancel a session like the day before because something had come up. And he texted me back and he said, I think I had done it 2 weeks in a row and just canceling to reschedule or something. And he had said, remember, this is your time. And this was the part I really liked. Maybe it's time to, enforce some boundaries for Sam. And I texted back, said, good point. But I thought that was so interesting about any kind of whatever we're doing for ourselves to kind of navigate through potential burnout or just the everyday, feelings that we have both as clinicians or just as human beings.
Yeah.
I thought that was such a great reminder of just the intention of
Yes.
self-care and the intention of it's not something that's just a nice thing to have in your life. It's actually like a kind of a need.
Yes.
And I thought that for myself, that was such a good reminder, not just for therapy itself, but also just for anything. So if, like you said, if it's exercise, if it's cooking meals, if it's playing tennis, if it's like consistent sleep, whatever the case might be, to kind of protect that and to say, these aren't really negotiable. These are actually things that are a part of my schedule.
Yes.
And so that was my little reminder. That definitely helped.
I liked that. I mean,
Yeah.
I agree. You have to make time for yourself.
Yeah. So, Keri, I have one more question for you. This has sort of become a staple question in our nearing 10 episodes of Courage Speaks, actually. And it's this. That you can answer this question in any way. It doesn't have to be specific to your work or career, or it could be really just however you'd like to answer it. So I'll ask it and I'll stop yapping and I'll see what your answer is. What is the last thing that surprised you?
What is the last thing that surprised me? Oh, I wish I had more time to think about that. What is the last thing that surprised me? It has nothing to do with my work. I had a friend who I thought was in a happy marriage who just told me they're getting divorced.
Surprised you?
It really surprised me. It really surprised me. And then it brought me down where have I been? Have I not been a good friend? Did I not recognize this was happening? Takes you back to self-care. Like, do I spend enough time getting in touch with the people that are important to me to not know that this was going on in their life? So yeah, it was a surprise. And then I kind of internalized it and said, what does this mean about me? It has nothing to do with me, but
you know what? I do have one more question, actually. So for clinicians that are in training for mental health, anybody in social work, mental health counseling, whatever the case might be, that are in training, that are in graduate programs, that are in undergrad programs, interested in psychology, at really any path, that are looking at this as a career, what would be something that you feel like the kind of the classic, if you knew that now, if you knew then what you know now, what would be something that you feel like you could share that's been beneficial to you or just like helpful to know as you've worked in this field? And as for people that are starting on the precipice of kind of entering it?
Well, the first thing I would say is ask questions. Nothing makes me more frustrated than working with a newbie who thinks they know it all, because you can't. I still ask questions all the time. I think it's the best way to get knowledge. The other thing I would say is Try something you're uncomfortable with. It's the only way to experience new things. I very much got out of graduate school and did not want to touch drugs and alcohol and recovery and any of that. And because I had my own family history and issues with it, and it made me uncomfortable. And then I was in a situation where I was working with somebody who was going through recovery, and God, did I learn so much, whole nother world out there. And it's still not something I would not choose to take on substance abuse, clients, but I'm not afraid anymore.
Right.
And I feel like I have a lot of knowledge that I could share with other people now. So the great thing about being in the mental health field is you can never know it all. There's so much out there to learn. And I'm kind of jealous of people that are just starting because and they have access to so much now with the internet. But I would just say, try it all. Yeah. Try it all and ask lots of questions.
Try it all and ask lots of questions. Keri Golding, thank you so much again for joining Courage Speaks.
Thank you, Sam. This was very nice.
Would love to talk to you again soon. Yeah.
I appreciate it.
Thank you again, Keri, for the conversation. Thanks as always to John Marikoski for writing and producing our beautiful theme music. And thank you for tuning into Courage Speaks. We want to remind our listeners that the information and discussions presented in this podcast are intended solely for educational purposes. The content provided is not a substitute for professional medical advice, diagnosis, or treatment. It's important to consult with qualified mental health professionals or healthcare providers for personalized guidance regarding your individual situation. While we strive to provide accurate and up-to-date information, the field of mental health is complex and ever-evolving. The views and opinions expressed by the host, guests, or participants are their own and do not necessarily reflect those of Courage to Connect Mental Health Center. Hope you enjoyed episode 9 of Courage Speaks. As always, I'm your host, Sam Sherman. Be kind, take care of yourselves, talk soon.